Fordyce'S granules. Fordyce'S granules are the normal variation, so it is not a lesion. And these are the developmental anomaly characterized by heterotropic collection of sebaceous gland. It is very important, collection of sebaceous gland at various sites in the oral cavity, and that it is covered with intact mucosa, and it is usually present on the submucosa. So these are this picture showing the Fordyce'S granules present on the cheek, showing the yellow spots. Next, moving on to pathogenesis. So it has been postulated that the occurrence of sebaceous gland in the mouth, it may result from the inclusion in the oral cavity of the ectoderm having some of the potentialities of the skin in the course of development of the maxillary and mandibular process during embryonic life. So occurrence of the sebaceous gland. Normally sebaceous gland are the sweat glands that they are present on the skin, but here it present on the oral mucosa. It produces Fordyce'S granules. Next, moving on to clinical features. The age it occurs at any age, and sex. Mainly it affects the males, and site. It is most commonly found on bilaterally in symmetrical pattern on the mucosa of the cheek, opposite to the molar teeth. So this is the important point. It has found on the bilaterally symmetrical pattern on the mucosa of the cheek, that is opposite to the molar, and it is also present on the lips. This picture showing the Fordyce'S granules present on the lips. So it is also found on the tongue, gingiva, frenum, palate, and facial pillar and inner surface of the lips. And the symptoms, patient feels roughness in the hand, and appearance, it appears small yellow spots either discretely separated or forming relatively large plaques. So these plaques are slightly above the surface of the tissue, and the surface there are sharply delineated with smooth surface, but it is not ulcerated, and its consistency is slightly cheesy consistency. It is a plaque-like lesion. It is present or a confluent sheets, or may sometimes they occur in clusters and may also form plaque-like lesion. And in tongue, it appears as a dome-shaped nodules from a few millimeters to 2 cm in diameter on the midline dorsum of the tongue. So in hormonal effect, it rapidly increases in number at the time of puberty, and it is also continues to increase throughout the adult life. And histopathological, it consists of the sebaceous acini. These are the important points. So this picture showing the histological picture of the Fordyce'S granules. There is present of overlaying epithelium and duct of sebaceous gland. These sebaceous glands are arranged in lobules and presence of connective tissue. This is the Fordyce'S granule. So presence of sebaceous gland. So diagnosis, clinical diagnosis, small yellow discrete spot separated from the oral mucosa, and management, no treatment is required. If it causes disfigurement, large plaque, then we go for the surgical removal can be done. So we have to remember Fordyce'S granules are the developmental anomaly, and it is the normal variation. It is due to the heterotropic collection of the sebaceous gland in the oral mucosa.